Hello everyone, my name is Abraham Peled. I'm a psychiatrist, and for many years I'm trying to reformulate mental disorders as brain disorders. And in the previous videos I talked about, go search my video, about consciousness and how consciousness is related to psychosis and schizophrenia. Now in this video I will want to take the parts that I talked about in these videos and begin to see how we can try to treat these disturbances using neuromodulatory technology. Neuromodulation is a technology where you can control brain activity in various ways, DBS, TMS, and so on. And in general, I will try just to show a general direction where we should go and how we should go about when we want to cure these terrible disturbances, which are actually schizophrenia, psychosis, negative symptoms, and so on. So in the previous videos, I talked about the executive network relevant to consciousness, and I talked about the network organization, the small world network organization related to how consciousness is organized as an emergent property from an optimal brain. I talked about the disturbance, which are related to the executive network and disconnection dynamics of that network, or overconnection dynamics. So now, using this information, we can begin and start to think about how to neuromodulate and help these patients. So the first target we will need to target would be the executive network, because that's the network that is related to transmodal, whole brain, global organization, which have the emergent property of optimal consciousness. So we know the hubs of the executive network, the prefrontal, and so on, parietal, and so on. And we should try to target these ones, or we should at least target these subcortical or maybe hubs which are more related to global massive connectivity in the instant range or the time window of a millisecond range, because we have seen that psychosis is related to millisecond range activity. So we have these two coordinates, the hubs of the central executive network and the time scales of activity, which would be a firing rate, millisecond range activity. Now, one of the hubs that has already been generating a lot of information is the prefrontal cortex. We know that in schizophrenia, hypofrontality was described, and repeatedly when you go again and again, you see the prefrontal involvement in schizophrenia and psychosis. Also, you see something very interesting. You see also hub centers like hippocampal, medial, temporal, those regions which have to do with whole brain connectivity. They justify the hypothesis that we just talked about consciousness being related to whole brain organization. So these are the hubs that we should look for in order to intervene. Now, one example could be findings that were repeatedly shown recently, at least on animals, that you can intervene in the prefrontal cortex in the, I think, fourth or fifth layer of the pyramidal cells, which have a lot of connectivity. They are hub, they have input and output connectivity to the whole brain, and they are regulated by interneurons. And these interneurons are acting as regulators of input-output relationships. And by increasing or reducing threshold functions of these networks, you can actually overconnect or disconnect the system. And actually, there is work that shows that if you can control these interneurons, you can actually control whole brain gamma activity. And the gamma activity reflects the connectivity, a global connectivity, while the intervention in the hub reflects a local intervention. So it's very interesting that you can intervene in the hub, in the local place, and have an effect of controlling or modulating whole brain organization. So that could give us an idea how a brain pacemaker in the future to cure schizophrenia would look like. We will target hubs. We will regulate their connectivity, input-output relationships. Let's say reducing the threshold increases the connectivity by allowing input to become output easily, And raising the threshold will block the input-output relationships, that the input does not get any output, thus disconnecting the network. Now, by playing with this regulation of overconnectivity and disconnectivity, based on our previous videos, can explain how we can control optimal conscious experience and actually eliminate the disturbances of disconnection or the disturbances of overconnection and re-optimize brain activity, eliminating all the symptoms of schizophrenia. So this is actually the future. So we are targeting whole brain organization, executive network, time scale of millisecond range, the hubs of the central executive network, trying to re-optimize small world network organization of the brain using intervention at the hubs. A further step would be a dynamic regulation of that. We can measure the whole brain organization instantaneously, and this information will give a feedback to a loop that will control the hubs. So when the systems tend to disintegrate, the loop information will give an order for the hub to reintegrate, and the opposite. And this way you get a feedback loop between disintegration and overintegration, making the brain stay at the optimal condition where there are no symptoms of schizophrenia anymore. Okay, you can register my channel and go to my website, brainprofiler.online, and continue to hear about other mental disorders.